So we had this gray beige wall outside the Integrative Medicine Center, and Dr. Lopez was hearing from patients about the color and how bland it was. And so we started thinking about what we could do, and I contacted Ian with the Arts and Medicine program here at MD Anderson, and he brought us some proposals, and we loved his ideas. So he had children come and digitally produce art.
We came up with the idea for the material and the digital process as a result of trying to meet our patients' needs. We could include patients who are in bed in a mural project, which was the idea, and to include patients who had limited mobility and limited range of motion, and get them to work on something that was a large scale.
It was cool, you know. We made our own artwork, different people. And Ian, he took pictures of it and put it on the computer. And then we transferred it from the computer to the horses, you know, on the computer. So, you know, it came out real nice. I liked it.
Everyone that's going through the same situation, kind of working on one big piece. Even if you don't get to meet people necessarily, like when I did my part, it's just me and Ian. But seeing the one big final product is pretty cool, because I know it's everyone who's sharing the same story, working on such a big scale project. It's pretty neat.
And I heard from a lot of the patients about this sense of them wanting to enhance the experience of the other patients.
It was fun. I liked doing painting and I liked doing art. It was very fun. When
you're here, it's kind of hard to not be focused on your treatment, and you kind of live around it, which can take a toll on you, honestly, if that's all you have to do. So the few hours you get to just focus on painting and not have to think about transfusions or infusion or chemotherapy or radiation or something like that really helps you.
It makes me feel good. It's like I never even was here.
We all named it, but my word in it was wonder, and hers was light, and hers was hope.
How wonderful is this for the community? Not only to show off what our children do, but just to show the community it's full of life and hope. How much better is it to look at this than a plywood ugly wall, you know?
There was nothing compared to that moment when the clowns were here and the accordion player was playing the accordion, and we were, you know, celebrating inside the hospital with this big group of people who had come with their families, brought their families, and then the accordion leads the parade, the clowns are leading the parade, and we walked out those doors, and the little Cobb kids were like leading the charge. If you wouldn't have known you were in the lobby of a, you know, cancer center, I mean, it felt like a true celebration.
I thought it looked great. It was amazing.